Hello, everyone, and welcome to this reality check where we are going to dig into whether you are US investor ready. So my name is Therese Oppegård. And this event today is a collaboration between Norwegian's market cluster, which I represent, Norway Health Tech, Oslo Cancer Cluster, and the Life Science Cluster. And you will meet my cluster colleagues, Chelsea, Trine, and Jutta during this event today. So this event is an activity related to an initiative called USA Next. And in this USA Next, Norwegians, the clusters, have joined forces to help health tech companies looking towards entering the US. Our aim is to utilize each other's interfaces, expertise, and networks in different parts of the US to the benefit of companies within different segments and in the different clusters.
Okay.
I'm sorry, I can't. Yeah, I just muted. So we have an exciting agenda today, starting with a panel discussion on today's topic with our investors, and they will all introduce themselves later. Then we will move over to the reality check, where 3 companies will get the opportunity to do their pitch and get some direct feedback from our investors afterwards. And we urge all of you listening to pay attention to the dialogue, as we think you will pick up some tips and learning that can be beneficial for you and your company. And finally, we have some audience Q&A at the end, where we invite you all to engage with our investors with your own questions. And this session is going to be moderated. So place your question in the chat and we'll see how many we will have time for at the end. And some practicalities then, just before I hand it over to Chelsea. This webinar is being recorded and the first part will be published on the cluster's website. The pitching and the Q&A will not be published, so please have your notebooks ready and listen in. Please keep your microphones on mute unless you are speaking, and please put your camera on when you are speaking. And you are very welcome to keep your camera on at all times so we can see you. So I think that's all from me, and Chelsea, you can take over from here.
Thank you very much. For those of you I haven't met, my name is Chelsea Ranger. In this context, I'm working with the Life Science Cluster, and I support investor relations and business development for our early and investable stage members. So today I'm going to kick off the panel discussion, and we have 4 wonderful guest speakers who have been very kind enough to take time out of their day to help us discuss some of the differences that you might see in how investors think or behave between the Nordics and the US, and some of the things that you might want to consider in your early journey. So as has already been mentioned, there is an open QA at the end of the webinar after the company pitches. So you can type your questions into the chat. You are also able to like somebody else's question, and that sort of will push it up in the queue. So if you like a question, make sure to like it. So I'm going to kick off our speaker introductions, and we're going to begin with our long distance guests. So Kelsey Tsai, you are from Sandbox and the Blue Venture Fund, joining from Chicago. Thank you very much for coming today. Would you please just introduce yourself and tell us about your background?
Yeah, sure. Well, thanks again for having me. As Chelsea mentioned, I'm based in Chicago, but originally from the East Coast in Boston. I work for a company called Sandbox, which manages the Blue Venture Fund. We invest on behalf of the Blue Cross Blue Shield Association and 33 out of the 35 Blue plans. So collectively, the Blue plans represent 1 in 3 insured Americans. So it's one of the largest collective payer systems in the US. We look for things that are strategically relevant to the Blues. So anything that increases quality, decreases costs, or increases engagement is fair game. And we're technically stage agnostic. Before all of this, I came straight from business school, and before that I had a research, equity research background and covered biotech and contract research organizations. But really excited for being here, and thanks for having me.
Thanks so much for joining us, and I'm very excited to hear what it is you're going to have to say today. Also in the US, we have Jonathan Gertler from BioVentures MedTech Fund and Back Bay Life Science Advisors. And if I'm guessing, you're in Boston, but I could be wrong.
I'm actually in our BioVentures office, which is in Wellesley, because it was only 5 minutes away from my house.
Okay, very
So
good.
Boston's a much more miserable commute at this hour.
So tell us about yourself. Give us your background for everybody who hasn't met you yet.
Hi, and nice to meet everybody in Chelsea, and everybody, thanks for inviting me to be here as we're moving across the country. We've gone from Chicago to Boston, Kelsey's, I guess, hometown, it sounds like, which is great. So I have two hats or three hats. I am a partner in BioVentures MedTech funds. At present, we are raising our fifth growth capital fund, which is a much later stage fund than we previously engaged in. We've always done mixed funds with both early stage and growth capital, and we've in the last two funds focused solely on MedTech and health tech, but have invested across sectors over the 20-year history of the fund. And I'm the most recent partner to join BioVentures to really help catalyze this growth capital fund, which is very near to being launched fully. I also am, as Chelsea mentioned, CEO of Back Bay Life Science Advisors. That is a 13-year-old integrated strategy consulting and investment banking firm headquartered in Boston, but with a very, very strong presence globally, including a great deal of work in the Nordics, of which we are very proud. I'll do a shout out for our growth summit, which is, I think, now at capacity, but it is on the Back Bay website, which is being held in late October in Copenhagen. I've been a serial entrepreneur as well. I've started a med tech company which sold successfully in the early 2000s, and currently am pleased with an early stage biotech that is moving forward on a very interesting vascular biology play, and a mature commercial stage health tech company that is just launching into its commercial space. And my background is that of many years in academic surgery. I was a vascular surgeon and an associate professor at Harvard Medical School, and prior to Back Bay, I'd spent about a decade both working in venture capital part-time while at the MGH, and then leading healthcare investment banking groups for 10 years prior to forming Back Bay. So delighted to be here, and hopefully we can traverse all of the relevant subjects that face young companies, which is really one of my favorite things to engage in. So thank you.
Thank you, Jonathan. And I know that you have your event in Copenhagen in October, but we'll also be seeing you in the Nordics next week.
Next week. It's my every 2-week commute to the Nordics in the fall.
Yes, it's great.
I'm
So
staying on CET.
Yeah. So for those of you who want to meet Jonathan, he will be at NLS Days. And now we're going to come back to the Nordics as well. We're going to talk to another fellow American who's based here in Norway, something I'm excited about. Catherine Mellis from Haitian Ventures. Would you come in and introduce yourself?
Of course. Yes, I somewhat interestingly, I guess, straddle the two markets. So originally grew up out in San Francisco, and background in bioengineering from UC Berkeley, and worked several years in kind of the biopharma strategy consulting area, out in the Bay Area, doing a mix of forecasting, portfolio optimization, new product launches, before deciding to kind of hop across the water, and went over to London to do my MBA at London Business School, after which I ended up joining the healthcare investment banking group out of Goldman's, and spent another several years working on large-scale M&A and IPO transactions in kind of the biopharma and diagnostic space, before deciding to return a little bit to my Silicon Valley roots, and move more into the venture space. So joined Haitian out of their Oslo office just over a year ago, where focus on life science companies, seed and early Series A, across Europe, and do everything from new investments, but also do a fair amount of work with our existing portfolio companies, helping them grow and develop, and figure out their financing strategies as well.
Oh, thank you. I'm very happy that you were able to join us today. And I know since we're mentioning NLS Days, a lot of the audience will be at NLS Days. You will not be there, but your colleague Georgina will be.
Correct. And Roger.
Okay, very good. All right. And last but definitely not least, Pekka Simula from the Innovestor Life Science Fund in Finland. Welcome. Thank you for joining us.
Thank you, Chelsea. I hope you can still hear me. I switched to another microphone, but
yep.
Wonderful to be here. And I'd actually say that I am the least. I mean, all my fellow panelists are much stronger in their US experience. My background is a life science startup person. I've actually been taking one life science startup company to the US personally, so that's my own hands-on experience in being US investor ready and US ready. We definitely weren't in all aspects, but maybe that's also a good lesson learned. And currently with Investor Life Science, so we are a new venture capital company based in Helsinki, investing in the Nordics out of our brand new fund, and broadly in life-saving sciences, as we say. So therapeutics, medtech, diagnostics, and digital health.
That's wonderful. Thank you, Pekka. And I know we've had a very good relationship bringing Mila into Norway a few times. And I just found out today that you and all of your colleagues will be at Analyst Days. So that's
very
great.
much looking forward to it.
Yeah, that's wonderful. Okay, so here's how we're going to do this. I'm going to kick off with a series of questions. I am going to direct the question to a first person. Whoever wants to add on to that original answer, if you'll raise your digital hand, and I'm going to call on you immediately after. So, Catherine, we're going to pin the first question towards you. And I'd like for you to talk about some of the key differences between US and Nordic investor thinking or behavior that you think are important for our Nordic audience to better understand.
Okay, great question. I would say one of the aspects that really does come to mind is, just thinking through the types of investors and the investor classes that you see in the Nordics versus in the US. I would say in Norway, it's not uncommon to see rather long cap tables populated with a lot of family offices and private individuals. Whereas in the US, I would say there's a few more specialist funds, and maybe this will evolve as Innovestor and Hadean, are coming into that space. But I would say traditionally, in the US, there's just been a lot more of those specialist venture funds. So you tend to see slightly shorter cap tables, populated almost entirely by professional funds. And I would say the distinction that is important to keep in mind is just how that then translates to both valuations and the types of terms that founders might be seeing. And so being familiar with things like preference shares instead of all common shares, liquidation preference, some of these terms that are very common for, all VCs, but especially US-based VCs, I think will be helpful for any founders who are looking to be conversant and potentially negotiating term sheets with those types of investors.
Yeah, I think that's a really important distinction. Jonathan, maybe you want to add to Catherine, since I know you have a broad experience from having worked 40% of back-based businesses in the Nordics, so you spend a lot of time going back and forth. How would you add to that? Oh, you're on mute. Hold on. I can't unmute you, Jonathan. Sorry.
So many people in this world would like to mute me, but I guess I can only do it myself. So to me, the critical issues are in the cross-border world. One is that I think U.S. investors, and I think we can talk further even about the U.S. investor business model. I think there's no question that Nordic investors, many of them, and Hadean is an example, I mean, these are still private businesses at the end of the day. They're not government sponsored, although they do have often government LPs and government interest in the funds. And so there's an ecosystem development motive that is, I think, much more prevalent in Nordic funds than in US funds. US funds, and I say this somewhat facetiously, but I'm going to say it overtly, we are asset managers. Don't let us ever convince you that we're anything else. We are, we have been charged with raising capital from other sources, deploying that capital, and delivering returns to that capital. And as part of that, coincident with that, is to find good companies that will have a great trajectory, have terms in place that are self-protective, meaning downside protection, can capture upside and deliver returns. And it's a much more fully business-like approach. And then there are also size of funds and amount of money that needs to be deployed, issues in terms of how far afield you can go, how closely you can monitor. So that plus the excess of capital in the United States versus the relative dearth of capital in the Nordics creates a discrepancy. What I would say, and I'll stop at this because there's a lot more to discuss around those business models, is that for US investors to be interested, there has to be clear plans that have a local feel to them, a true understanding of what is being tackled. And then in terms of dealing with the investors that have initially funded the companies, understanding that their motivations, their valuations, their structures are often exceedingly different from what we are used to. I will say, however, as somebody who's fully intending to invest in the Nordics, the responsibility to take the Nordic opportunities, which I think are remarkable and legion and valued well and capital efficient, and translate them means that there's an equal responsibility on the American side to reach across, to educate, to understand, to accept some of the cultural differences in the Nordics in order to make this all work together. But I think that remains a bit of a challenge for most groups on both sides. I'll stop there, Chelsea. I probably didn't answer the question fully, but
you answered
lots to talk
beautifully.
about.
Yeah, there is a lot to talk about. And I actually, several questions came up that were not on my list. So I'm going to pivot actually over to you, Kelsey, because after everything that Jonathan just said, now you've recently made contact with our cluster. We've been in touch now for the first time. So this might be the first time that you're engaging in a Nordic setting. Is that true? And what are you excited to learn about that maybe we can touch upon today?
Yeah, sure. It is actually my first experience engaging with a Nordic organization. We do invest outside of the US. We have a couple startups that are based out of the UK and Oxford in particular. So we look for things that are across healthcare. So tech-enabled services is one. Data, technology, and operations is kind of another bucket. But those are kind of maybe harder to translate in some regards because there are a lot of US idiosyncrasies to the system. And so those companies need to have a really good understanding or pilot, I think. The last bucket is things that touch the practice of medicine. So we call that clinical. Basically, diagnostics fall within that bucket. We don't invest in therapeutics. But some of those technologies, I think, are probably more easily translated from maybe ex-US countries into the US, which is really exciting. I think in particular, something that I find really exciting is that the cost of development sometimes is a lot cheaper in other areas, just given maybe the access to patient samples or being able to work with one payer, for example, or one pilot and getting a ton of data and evidence generation from that. So I think that's really exciting, reaching out to different parts of the world that might have ecosystems that are better set up to really develop, especially in the early stages. And then there's some great technology, I think, that's applicable around the world. And so that's for me what's most exciting here.
Yeah, that's very, very excited that you've taken an interest as well and joined this. And we had this discussion when we spoke last week. We started talking about local leads, right? Of course, this is something that a number of investors say is very important. So, Pekka, I'm going to pick on you for this question, and then we can bring in the others. But let's talk about, for example, in order to gain Kelsey's interest, it might be of interest for a company to have a local lead. And what do we do to make sure that we can ensure that, or does that, from your perspective, challenge a company if they haven't been able to source a local lead?
I would say yes, and I can tap into my own experiences more than 10 years ago when I was raising funding for a local Finland-based startup and speaking to foreign investors who asked me for a local lead. And I'm like, hey, I come from Finland. There is no local lead. There is no life science VC. And that's an acceptable answer, obviously, but it still doesn't open any doors for you. So yes, I think for many players, it is crucial to have someone who knows the local environment, knows the local laws, but also understands something of the business. So it's not an optimal basis that there's a generalist investor in a drug development company, and then a US-based special investor wants to join the game.
Catherine, what would you like to add?
Sorry, first time using this hand function, but no, I would completely agree. I think we've come across several situations, both in the Nordics and in Europe more broadly, where US investors are just looking for that slightly more local day-to-day presence and frankly, network, especially if it's a young growing company, they're going to need to be hiring a ton, and having someone with the network who can tap in and be useful is really helpful. And just to your question on how can we enable that, I would just say, you can never start too early. We have companies that we've been tracking for 2-3 years, right? It may not necessarily be the right time when you first reach out, but just establishing those relationships is also a useful metric to just get that initial early feedback. What would they like to see at such and such point where you might be investable? So it can be, I think, useful on both sides to establish that relationship as early as possible versus, hey, we have a potential US party who's interested. How do you feel about jumping in? That's usually, I would say, going to be a less successful strategy.
Yeah, but that begs the question, you can never start too early. So is that the same for reaching out to Nordic investors as it would be to US investors? Because Jonathan, and I'm going to pick on one particular point you made last week where we talked about valuations and ticket sizes, and the requirements are different between the two, right? So Jonathan, jump on that and tell me what you think.
So I'll get to the valuation ticket size question in just a second. I think that one of the critical issues in terms of Nordic investors, Nordic companies speaking to American investors, as many of us all are in different parts of life, can be dogmatic. We have a specific point of view. We have our sense of what needs to get done. And I will emphasize that even though there are great technologies in the Nordics, cancer biology is identical in Aarhus and Kansas City. MedTech and health tech are profoundly different. Our systems need to integrate in different ways. You can't get adoption without a whole bunch of technology safety, HIPAA safety across the board. And so if those things are not in place or planned for, it is not actually an investable proposition unless you're at a very early stage just trying to develop a technology and then hope that it can translate across the pond. I think with regard to getting to know companies from an American investor perspective, I urge companies, and Back Bay, does this constantly with companies as well, control the debate. Don't come into those discussions seeking their view alone of what they would like to have done. And Catherine, I agree with you. You do need to explore that fully, but you also need to come in with your point of view, at the very least demonstrating that you've done the homework, that you've thought it through, you understand the challenges, because if you don't understand the challenges fully, you can't possibly come up with solutions. And then recognize that business models, as I alluded to earlier, have to do with fund size. It has to do with ability to travel, partnership, attention span, to put it nicely, the ability to, whether you're at the front end or the back end of your fund, and how quickly you need returns on that fund. These are all dynamics in which you should do your homework. And I'm giving a talk on how to talk to venture capitalists in Copenhagen, I think at the end of October, after our meeting at the BII. And it's going to be, I hope, a stand-up comedy routine, in part because I really think we need to emphasize how unbelievably idiosyncratic, to put it nicely, all VCs can be. And if you don't prepare fully to go into those conversations and know who your audience is, just like any performance art, you're not going to grab your audience. And so those are the things that I think are critical.
Yeah. And actually, I'm going to come back with a point about that, about knowing the audience, because I think that's a very important point. But I want to touch on something that you've already mentioned on. And Kelsey, I want to bring you into this because, of course, when we're talking about real implementation, right? That means different things according to different companies and how the structure of their healthcare system works. And so when we're talking about an early stage company verifying the likelihood of real implementation, particularly in the US where insurance is something that has to be so heavily factored in as well, how does a company verify that? Who can they talk to verify implementation?
Yeah, I can jump in. So I think it totally depends on the type of company. I think when you're thinking through more on the life science side, or for us, we typically look at a lot of diagnostic companies, for example. I think part of the key question is how generalizable is the data set that you have on hand to broader parts of the US or other parts of the world. And so kind of bridging that gap, either having a plan in place on, hey, we're going to need patient samples. This is the person we're going to hire, or these are the institutions in the US that we're going to target, can be really helpful. Just having that kind of laid out, understanding everyone's coming from a starting point and might not necessarily have that in place, but at least being able to plan that out is really important. When thinking about maybe the harder translation gap with maybe healthcare services company, I think is probably the hardest, just given that the US is just set up so differently. I think understanding how you put pilots in place and who do you partner with to really help validate that. So I think probably step one is putting a board of strategic advisors around your company. Strategic advisors, they kind of, there's a whole spectrum. Some people you just call on ad hoc, others are kind of working with you day in and day out and helping with intros, for example. But at least putting that together and starting to think about who are the people that you need that might necessarily don't need to be on your cap table, but will answer the phone call when you do reach out to them. So that's one kind of an immediate thing that you could do. And then maybe the other thing is targeting what are the institutions. So there's a lot of providers, for example, a lot of academic medical centers that are great for piloting. A couple payers might have some programs in place. So when you think about the earliest stage company, I might want to target some of the innovation centers or some of the accelerators, for example, that are launch pads for that. And so doing the research and trying to figure out who do you want to partner with, I think is really important. And usually the best way to get into those folks, I think at the earliest stages is probably through maybe some of those programs.
I think that's a really good answer. Guys, I've already gotten the notice that we have hit our time. This flew by. I have a whole series of other questions that I know are relevant. So I'm going to put those in the chat. Hopefully you guys like them and vote them up, or you have questions of your own. We are now going to start with the company pitches. So the pitches are going to last 7 minutes, and then the investors are going to be giving their much appreciated feedback on each of those pitches. So I am going to hand it over to my colleague, Trina. Thank you all very much for the panel discussion so far. Trina?